Methodist Hospital Sugar Land has a number of seminars open to the public throughout the year, and they recently inaugurated their new conference center with a well-attended presentation on essential tremor disorders and treatment.
Sure. Today we're having a seminar on deep brain stimulation and the surgery that's involved. So we're going to go over a few things as far as Parkinson's disease, essential tremor, dystonia, the surgical risks, benefits, and look at some patient experiences as well. Yeah, so the onset with Parkinson's is usually around 60 to 65 years old. There are young onset Parkinson's, and there's also patients that experience symptoms later in life, but the average is about 60 to 65. Typically there's some symptoms that we look for include stiffness or rigidity in the muscles and in the joints, and also we look at slow movement and tremor.
Parkinson's disease is linked to a neurotransmitter called dopamine, in that a patient's brain slowly stops producing it, causing less control over movement.
It's becoming more and more common as the population ages, so if you start to notice some symptoms that are unusual, tremor, slow movement, it's best to get looked at. So I'd recommend going to check with your primary care doctor, and then after that, if needed, referral to a neurologist.
Essential tremor differs from Parkinson's disease in that the tremor tends to increase when the body is in motion, the opposite of Parkinson's. It also tends to most often affect the head and hands, and sometimes the voice.
Yes, and so once you would come to our office or come to my office, we would do a detailed history, detailed physical exam, very comprehensive, to look at different things that we would find in different types of disorders, and formulate a plan and kind of take things from there.
There are medicines to alleviate the symptoms of Parkinson's and essential tremor, but sometimes they're not enough. And that is when a surgical procedure called deep brain stimulation comes in. It involves implanting electrodes directly into the brain, and though that may sound like science fiction, it has been FDA approved since 1997.
This is just a patient that has essential tremor, and just show you an example of before and after with stimulation. The trade name for the device is Activa, and you can see it's and we're not exaggerating, this is common.
Yeah, so there's a lot of great information typically out there, but I'd be cautious about things that you read. So definitely want to look at certain websites that are there are some notable websites that are out there. If there's some information that's needed, we have some information. You can call the Methodist Sugar Land Neuroscience Center, and definitely if it's something that we need to look at, I can provide that information as well.
For more information, go online to www.parkinson.org, www.essentialtremor.org, or houstonmethodist.org.
Becoming more and more common to see people with these disorders, Parkinson's disease, essential tremor, or otherwise. Recommend evaluation by a neurologist or a movement disorders specialist such as myself to make sure that we have the right diagnosis and work on a treatment plan.
For Healthwise, this is Randall Williams.